One of the biggest mistakes that most individuals make when trying to sell a plan of care is that they don't understand the definition between convincing and persuasion. Now, before I go into that, just understand that what we're seeing with most either owners or providers or even admins is that they're doing two things when it comes to sale. Number one is they're selling from their own pocket, or they're doing this thing that I like to call commission breath. Now, selling from their own pocket, what that means, and I used to do the very same thing, right? So it was one of those things that is just like, I couldn't afford to pay for some of these package pricing and stuff like that. So how would a patient be able to afford that if I wasn't able to afford that? And we see that a lot of times too. Like, students are coming out with high student loans, or owners are trying to pay payroll and they're in debt a little bit or whatever that looks like. And they're like, well, if I'm not going to be able to pay for it, how is a patient going to be able to pay for that? And that kind of energy there, that incongruency is it almost puts off the sale a little bit, because patients could sense that, they could feel that. There's a weird energy there. The other thing is there's this thing called commission breath, and this happens a little bit more with our owners and our companies that like to sell, like, hey, if you make a sale, I'll give you a commission. And a lot of times what happens is these either providers or admins or whatever that looks like, is they're showing up, and then when they present the sale, they're doing it for their reasons and not the patient's. And that's the definition of convincing when it comes to sales. It's convincing someone to do something is you're trying to convince a patient to buy a plan of care or buy a package for your reasons so that you can make a commission or whatever that looks like, or fill your schedule, because a lot of times, there's productivity standards here, like you need to fill your schedule or you don't have a job anymore. So it's like, hey, I need you to buy this package so I can fill my schedule and keep my job. And it's one of those things that, like, convincing someone to do something is for your reasons, whereas the other definition that we're looking at here, persuasion, is that we're trying to persuade someone to do something for their reasons and not ours. And what do I mean by that? So if you think about it, like, if a patient comes in and they don't buy, or they do buy your offer, your life's really not going to change all that much. Now, compounding, like, yeah, if 10 patients come in, or 20 patients or 40 patients came in and they all bought packages, yeah, that's where your life might change, a little bit. But if a patient comes in and takes advantage of your offer and actually comes in and gets your medical services, and they actually do the appointments and they stay till the end, they get the results, their life is going to be significantly better. So I want you guys to understand that, is that, like, when a patient comes in and they don't buy, or they do buy, as a provider or owner, your life's not going to change all that much. Like, we'll be okay. It's not a big deal. It's like our program. Owner comes in, buy or don't buy, not a big deal. It's like, we'll either work with somebody else, and our life's not really gonna change all that much, right? It's not like we're sitting here in, like, survival mode, like, oh my gosh, I need to make the sale or else, like, we can't pay our bills, right? It's not gonna change all that much. However, like, if an owner comes in and, they start implementing this stuff, and now all of a sudden their practice starts to take off, like, their life might significantly be better, right? So the same thing happens with your patients and providers. It's just like, it's a buy or don't buy type of energy. But I really want you guys to understand the difference here. Convincing someone is to do things for your reason, and persuasion is to do it for their reasons. Now, from a persuasion standpoint, what we really just need to do here is we need to present the offer in a way that we're just giving the patient enough information to make a decision to buy or to not to buy, right? That is the question, right? That's all that we're trying to do here, is we want to make sure that the patient understands, like, hey, what's the process here, right? What's your diagnosis? What's your prognosis? What's your plan of care? Do they actually believe that the plan of care is going to work for them? Like, do they understand the process? Then, is there any plans that are coming up that will prevent them from coming in? How long is this going to take? What's the duration? What's the time commitment here? Because most people these days are pressed for time. Most people will pay a lot of money to get their time back. That's why we're seeing right now, patients don't necessarily want one-on-one for an hour, or one-on-one for a half hour, or be in the clinic for 2 hours. I used to have patients in our facility, as soon as it hit an hour and 5 minutes, they start looking at the clock and be like, how much longer is this gonna be? I thought this was only an hour. An hour could be too long for some folks, especially in busier cities. Like, they wanna get in and get out. Results trump time. So it's one of those things that people will pay a lot of money to get more of their time back. Then, some of you guys are gonna reach partner objections and stuff like that. So you want to make sure that their partner is on board. You've got good family support. And then finally, we want to make sure that, like, we can actually give them enough information of what it's going to cost and what that looks like to move forward. So that is going to be persuasion. Persuasion is just giving them enough information to make a decision, and we're making the decision based on what they want and not what we want. They want a result. They want to get better. Not that we want to make a sale and we want to go buy Lambos and go on fancy vacation and do all this other stuff, people could sense that. So when you start to show up in the marketplace, buy or don't buy, all be good. But I wanted to give you enough information to make an informed decision. That's when you start to win the game. So if you guys like this content here, click the follow and subscribe button above. And then also if you want to learn more about selling packages, custom packages to your patients and doing it with ease, go ahead and click on the link below to schedule a call with our team. And we would love to help you and your team members out with that. I'll see you guys on the next video.